Hi everyone, thanks for coming down to view our presentation. We're going to be talking about diabetes. We're nursing students from California University of Pennsylvania. And I guess we should start by introducing ourselves. I'm Jasmine.
I'm Mariah. My name's Jalen. And I'm Amy.
I have a poster, and I'm going to be telling you about what diabetes is, the symptoms, risk factors, and a little bit on prevention. So can anyone tell me what they think diabetes is? Does anyone know anything about diabetes? Yeah, it has something to do with sugar. Good job. Anything else? You know something?
Well, I have diabetes.
You do? What can you tell me about it?
I've been learning a lot about it. And many issues for done by my
Yeah, there are a lot of issues with diabetes. Okay, so by definition, diabetes is a group of diseases that results in too much sugar in the blood or high blood glucose. It's a metabolic disease in which the body is unable to produce any or enough insulin. Does anyone know what the most common type affecting older adults is? The most common type of diabetes? Type 1 or type 2? You're right. The most common type of diabetes affecting older adults is type 2 diabetes. There's no cure for diabetes, but it can be prevented. Managed. And the cause of diabetes is there's a hormone in your body called insulin, and in type 2 diabetes, the body either resists the effects of insulin or it doesn't produce enough insulin to meet glucose levels. Okay, so some symptoms of diabetes are blurry vision, increased thirst, or the need to urinate, feeling tired or ill, recurring skin, gum, or bladder infections, dry, itchy skin, unexpected weight loss, slow healing cuts, wounds, or bruises, and loss of feeling in the feet or tingling in your feet. Risk factors for diabetes are either non-modifiable, meaning something that you cannot change, or modifiable, something that you can change. So the non-modifiable risk factors for diabetes are a history of gestational diabetes, and that's just the type of diabetes that you develop when you're pregnant. Race or ethnic background, African Americans, Asians, Native Americans, and Hispanics are at an increased risk for developing diabetes. Family history, so if you have a blood relative with diabetes, then you're more susceptible to getting diabetes. And your age, the older you are, the higher your risk for developing diabetes. The modifiable risk factors, things that you can change, are overweight and obesity. You can change that by diet and exercise. Physical inactivity, hypertension, uncontrolled hypertension is a risk factor for diabetes. And your diet, foods high in fat, having a high-fat diet increases your risk for diabetes. And some things on prevention are just weight loss, just regular exercise, and healthy diet, low in fat, high in fiber. Questions?
I had a gastric bypass, and I but by having gastric bypass, can you become non-diabetic again?
Can you become diabetic by having a gastric?
I was diabetic before I had the surgery, and then I'm not diabetic. Does that happen with gastric?
There are cases that there are people that go into gastric bypass, and when they come back out, they can be non-diabetic. There's also cases that you can have a gastric bypass, and I guess there's instances where they say that you will be able to totally be taken off of your oral glycemic medication or your insulin, and sometimes it doesn't always happen like that. So you were one of the positive cases from that. That's good. Congratulations.
Before I had a surgery as well.
You said thank you for sharing. Any more questions?
Exactly.
Okay, that concludes my part of the presentation.
Okay, I'm going to talk about some complications of diabetes. Does anyone know any of the complications of diabetes?
Yeah, what's that?
What's that?
Renal failure,
Exactly, yeah, that's one of them.
high blood pressure.
Yep,
You're like a special.
I know.
I have juvenile diabetes, that's why I know
Oh, okay.
about it.
The diabetes can affect, the sugar can affect the blood vessels and cause a lot of problems. So some of them include retinopathy, eye problems. They can increase the pressure in your eyes and ultimately lead to blindness. There's lots of skin problems that can come. The sugar affects the blood vessels and can make them very small, so your circulation isn't as good, especially in your feet. And then that can lead to numbness, tingling, and then
Ms. Roseberger, please report to the RNAC office. Ms. Roseberger, please report to the RNAC office.
susceptible to getting wounds in your feet, and then they might not heal as well, and that can ultimately lead to amputation. Just like this woman over here said, kidney disease, your kidneys don't get enough blood like they need, and so you can't, your kidneys just don't work as well. And that can also lead to swelling in the legs because you're not getting rid of the fluid. Also, heart disease, like we talked about, the sugar in the diabetes can really just affect all aspects of blood vessels. So heart disease, heart attack, and stroke. Those are all risks. I'm going to talk about ways to prevent these complications. The first one being diet, like we talked about. So based on your diet here, your healthcare professionals have established that and make very nutritious meals for you. But I'm going to talk about the diabetic food pyramid, and it is recommended by the National Institutes of Health and the American Diabetic Association. So I'll talk about milks here first. So a serving of milk can be like a cup of yogurt or a cup of milk, fat-free milk, and you should get 2 servings of milk a day. Vegetables, I have on this handout here that I gave you a whole list of vegetables that you might be interested in, and it would be helpful for you to maybe identify a couple that you would eat off of that list so that you know, oh, that'd be a good vegetable to have. But like a half a cup of cooked carrot counts as a vegetable, or a side salad. We can talk about starches. You can have 8 starches a day for the normal person with diabetes. And those can include things like bread, whole wheat bread. The best kind of starches are the whole grains. Rice, beans, things like that. And then fruits, you should get 3 servings a day of fruits, and that can be a small apple, a half a cup of juice. There's lots of options that are listed on the
Christmas candy, please, I 102, Chris, I 102.
And then meat and meat substitutes, so things that have lots of protein, like an egg or peanut butter has a lot of protein even, and you should get 4 to 6 ounces a day, and then also like a slice of turkey or cooked meat, things like that count there. And then the fats and the sweets should be limited, and you can have up to 4 small servings of that per day. So like 1 strip of bacon is considered a fat, or 1 small donut would be considered a sweet. So that's the food aspect. And then another way to prevent some of these complications or prevent diabetes in itself is exercise. So it's best to even just get 5 minutes of exercise a day can have effects on lowering your blood sugar for 24 hours. So I'm going to go through 4 exercises that are low weight bearing exercises and that you can do just in the seated position. So if you want to do them with me, we can do arm circles out to our sides. Anyone wants to participate? Thank you. And then you can do them forwards or backwards, and that helps to strengthen the arm muscles. It can help with balance, your shoulder, improve circulation in your arms. And then you can do overhead hand raises, and that helps to raise your rib cage and increase your oxygenation. You can do that. And then seated, here, you can kick out in front, kick your legs out in front,
Kristen Stanley, please
each
dial
side,
102,
or you can lift your heels up off the floor, and those all increase circulation to your legs and feet, which can help prevent some of those things we talked about with your preventing the neuropathy to your feet and preventing ulcers that increases the circulation to your feet. That's all I have.
Next, I'm going to talk about some of the symptoms of hypoglycemia. Does anyone know here what hypoglycemia means? What? Very good. It means when your blood sugar is too low. And so this can result in a lot of signs and symptoms. So when your blood sugar is really low, does anyone know what kind of things your body feels if you have a low blood sugar? Good. Weakness,
Cold sweat.
cold sweat, confusion. Anyone else? Dizziness, very good. So yeah, you guys named a lot of like the main ones. So when your blood sugar is low, I gave you all a handout if you want to look. It shows picture descriptions of signs and symptoms of hypoglycemia. Some of these can include hunger, shakiness, nervousness, sweating, like the cold sweats you mentioned, dizziness or lightheadedness, which one of you said, sleepiness, confusion, difficulty speaking, anxiety, and weakness. So it's very important that if you recognize that you're having any of these symptoms that you tell somebody. You know, you don't just ignore it or brush it off and think, oh, like I'm just feeling funny, maybe I'll lay down for a while. It's very important that you let somebody know that you're feeling this way. That way they can, check your blood sugar, even if you don't have a history of diabetes. Sometimes if you haven't eaten in a day or if you're not feeling well, anyone can experience low blood sugar, so it's important to let somebody know. So if you do have a low blood sugar, there's a couple of things that you can do to resolve it. One of the most common things that you can do is have 4 ounces of any fruit juice or regular soft drink. So a lot of times people will drink orange juice or Pepsi. You just need 4 ounces of it, and a lot of times that'll bring you up enough to make you feel better and resolve some of your symptoms. You can also drink 8 ounces of milk. One of my favorites would probably be to have 5 to 6 pieces of hard candy. I have a sweet tooth. You can have a tablespoon of sugar or honey. I'm sure some of your nurses here, they can give you either like 3 to 4 tablets, or they have glucose gel. Those are some medications that we use. So there's a couple of things that you can do to prevent hypoglycemia. You can make sure that you're taking your diabetes medications regularly and on time when scheduled, and a lot of that is done for you before your meals. And, you make sure you get your insulin and then you eat. Make sure you maintain your appropriate meal plan. Like Mariah said, you have a whole food pyramid to follow, so make sure you get your proper serving each day. And then also just use caution during your daily activities when you're exercising. You want to make sure that you're checking your blood glucose like before, during, and after engaging in physical activity, because sometimes that can result in a low blood sugar if you haven't eaten yet. Does anyone have any questions about low blood sugar? No? Okay.
I'm going to talk about hyperglycemia. Does anybody know what hyperglycemia is? Too high. Yeah, so when your blood sugar is too high, it's basically the technical term for high blood sugar. It happens when your body has too little insulin or it can't use the insulin properly. Does anybody know what causes the hyperglycemia? What are some things you can do that cause hyperglycemia?
Not taking your medicine,
Yeah.
eating too much.
If you maybe ate more than you planned, ate a lot of carbs, like ate a whole large pizza and you were only supposed to have 1 piece. If you exercise less than you planned, even such things as going to the hospital can cause your diabetes or your sugar to go up. If you're stressed from family, anything along the lines of stress can bring up your blood sugar. You'd really be surprised in the hospital what we see with that. Does anybody know any types of symptoms related to hyperglycemia? What do you experience when that happens.
Thirsty.
Yes, extreme thirst, a lot more thirsty than you normally are when you're diabetic. You have to urinate a lot more often, you get really dry skin, you're excessively hungry. A lot of times, kind of like Mariah said, you can have blurred vision. If your blood sugar is through the roof, and everybody's blood sugar is different, they do have standards with it, but everybody can be different, so you have to ask your doctor what's high for you. So if 250 is normal for you, it might be extremely high for someone else. But that can lead to blurred vision or even loss of vision. Drowsiness, you'll be extremely fatigued. You'll have slow healing wounds. Even with diabetes, in general, you'll have slow healing wounds. So the best thing to do is to check your blood sugar. In a facility like this, it's good because it's monitored. Not only do you get your blood sugar checked by the nurses here, they help you with the food aspect of everything. So like I said, your doctor kind of manages your actual blood sugar. It tells you if it's a certain amount, this is how much insulin you need. So that's a good thing. And just like we said, if you want to manage it better, you got to eat better. And you also have to start exercising. That'll help bring down your glucose levels. Same thing if maybe you're taking insulin and it's not effective as much, then you want to go to your doctor and make sure that they can adjust your meds accordingly. Does anybody know what happens if you don't treat your diabetes and your hyperglycemia gets worse? Does anybody know what the word for that is called?
Ketoacidosis.
Yes, ketoacidosis. Basically, you can go into a diabetic coma. In cases like that, what happens is you end up getting admitted to the hospital, and we will put you on an insulin drip to bring it down accordingly because we don't want to drop you too fast. And in a case like that, what happens is your body releases ketones, and if it didn't, it would lead up to basically building up into your bloodstream. It's a life-threatening disease, and it needs immediate attention. Like I said, you'll be in the hospital if something like that would happen. Some signs and symptoms with ketoacidosis would be very increased shortness of breath. You'll have a fruity breath smell, they say, and you'll have nausea and vomiting, and you'll have a very dry mouth. You could drink a ton of fluid, and it'll still feel like all you want is something to drink. One good thing about diabetes, they have things like medical ID bans, and that's something really important because say that somebody got into a car accident or an accident in general, it's important to wear because when the medical emergency services, they know what's going on with you, or at least an aspect of what's happening. So your best practice at diabetes and overall between all of us is just diabetes management, going to your doctor, eating right, exercising properly, and learn how to detect whether your blood sugar is low or high. You want to treat your blood sugar early before it gets worse or, anything. So, does anybody have any questions?
I don't have any questions, but we had experience like that one. He went to Google. We actually saw him on the floor. Forms went swinging and got very, 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 very terrified. We had to call cops and everything, and the ambulance come in, but we ended up strapping down because she was so hot. She was so extremely hot. It was like 700. Yeah.
He was probably ketoacidosis at that point.
Yeah.
It kind of,
The personality.
yeah, it definitely changes you.
Didn't do anything to me. He was calling her dirty name and
Metabolic, you have a lot of stuff going on in your body, and that's kind of why you end up getting that shortness of breath. And whenever you start to breathe like you do, your CO2 levels go up, and when that happens, you're not thinking clearly. It's just like people who have COPD. Their CO2s are high, and if you ever notice, sometimes they can be real short with you sometimes. Unfortunately, that's kind of what happens with ketoacidosis. Your CO2 goes real high, and all your electrolytes are different, from normal. So that's probably why he ended up how he was. And I bet you once his sugar came down, he was back to his normal self.
he went to a diabetic coma.
Yeah.
Yeah.
Does anybody else have any other questions? These papers that I gave you and her, it kind of shows you, and there's pictures on them that shows you like signs and symptoms, and it kind of describes everything, so these will be good for you guys to look at, okay?
you all
Thank
for your
you.
time. We appreciate you coming and listening.